Good afternoon, everyone. I appreciate you joining the EOC training today. We have a presentation by Heather. She's done some research and summarized some reports that the FBI put out on active shooter. So we're going to let her start and give some updates and some information about that. And then I'll pick back up and do some other things on COVID and some of the CSEP issues. So Heather, I'm going to go ahead and turn it over to you.
All right. Good afternoon, everyone. The FBI did a series of white pages on active shooter incidents between 2000 and 2018. These white pages were published in 2019. It just shows the data, and it's actually really interesting. There was 277 active shooter events during that time, and this is only for the U.S. So throughout this presentation, we will talk about the casualty breakdown, the shooter outcomes, female shooters, shooter suicides, shooter weapons, and incident locations. This is a bar graph that I put together breaking down the casualty breakdowns by location. So we'll talk about different ones. Some of these are broken down into two different ones, and we'll get into that later on in the slideshow. So there was a total of 2,430 casualties, 884 were killed, 1,546 were wounded. That breaks down to 2,326 civilians, 104 LEO/security guards, and that breaks down even further into 92 law enforcement officers and 12 security personnel. The incidents with the highest casualty counts was the Las Vegas Route 91 Harvest Festival, the Pulse nightclub in Orlando, Florida, and the Aurora, Colorado Cinemark Century 16 shooting. So out of the 277 incidents, there was obviously more shooters, but 41% of them were apprehended by law enforcement, 37% committed suicide, 21% were killed, and that breaks down even farther into 55 were killed by law enforcement officers, 3 were killed by citizens, 1 was killed by a armed security guard, and only 5% are still at large. And so the graph is just overall looking at the numbers. So the 41%, the 273, and then 4, and then it breaks it on down even farther. Okay, and this graph shows us the shooter suicide locations. So there was 3 different locations where they showed that the shooters committed suicide. So at another location, at the scene after police arrived, and at the scene before police arrived. And actually, more shooters committed suicide at the scene before the police arrived rather than after they arrived or at another location. This was really interesting because they broke down female shooters on their own white page. So 12 of the 282 shooters were female, 6 committed suicide, 5 were apprehended by law enforcement, and 1 was killed by the police. Out of the 12 shooters, only 1 was not connected to the targets in some form or fashion, meaning they either didn't work for the business or the location, like they had no ties whatsoever. Out of the 12, 8 of the 12 shooters took place at a business location. 11 of the shooters used handguns. 1 shooter used a handgun, a rifle, and deployed an basically an IED that failed to go off. And then 4 of the women actually returned fire with the LEOs. So we got some sassy females in this group. Shooter weapons. The types of firearms, there was actually 283 shooters with handguns, 147 with long guns, and they break long guns down because when I was reading this, I was like, a long gun, like a musket? Like what? And they break it down in between rifles and shotguns, and there's no, they don't show a difference in like your automatic, your high-powered rifles or like a normal hunting rifle. So, and the only difference is it's between rifles and shotguns. Single and multiple firearms, 65% of them carried a single firearm, and 35% carried multiple firearms. So they had both a handgun and a long rifle, or a rifle, whichever, long gun, whatever you want to call it. 12 of the 4%, so it was 12 shooters in 11 incidents had access or deployed additional devices such as an IED, which is an improvised explosive device, incendiary devices, smoke grenades, and tear gas canisters. Okay, so now we're going to start breaking down incidents by location. So businesses close to pedestrian traffic. These are basically businesses where there's no public interaction, like it's more like a private office. So there was 37 incidents, 213 total casualties, 32 male shooters, and 5 females. 19 shooters committed suicide before the law enforcement arrived on scene. And the breakdown in the ages, there was 1 teen, 6 in their 20s, 12 in their 30s, and then it goes 8, 40, 50s, and then 60s was 2. Businesses open to pedestrian traffic. So this is more like an insurance place or a bank or somewhere like that. So 74 incidents occurred. There was a total of 586 casualties, 73 male shooters and 3 females. 2 of the pairs were husband and wife teams, and 1 shooter is still at large. This breaks it down. You had 2 teens. This is the ages of the shooters. 2 teens, 24 in their 20s, 15 in their 30s, 17 in their 40s, 8 in their 50s, 7 in their 60s, 2 in their 70s, and 1 unknown. So as we go through this, there's not a lot of data on the shooters that isn't unknown, except for a couple other incidents, but it was very rare that information on the shooter was not known. Malls actually have a pretty low active shooter incident, which I thought was really an interesting fact. So there at malls, there's only been 10 incidents occurred, 52 casualties. All of the shooters were males. 1 shooter was actually apprehended by a citizen. The age ranges were 4 in their teens, 5 in their 20s, and 1 in their 50s. Okay, so educational environment. So let me grab my cheat sheet, because this educational environment entails everything that has to do with schools or colleges. I mean, this even goes down into like the education board. I can't think of what it's called. Their meetings. So here we go. Okay, so there's 57 incidents, 391 total casualties, 55 male shooters and 2 females. 20 shooters were restrained by citizens. So this breaks it down to schools. It goes into their 6 6 incidents at elementary schools, 8 at middle, 24 at high schools, 1 at pre-K, 1 at junior, senior high schools, 2 at board meetings, and 15 at institutes of higher education, so like colleges. The shooters' ages were 12 and under, which I was really shocked at that one. It's 2. Teens, there's 31 shooters. 20s, there's 10. In their 30s, there's 4. 40s was 6. 50s was 3. And 60s was 1. Which the school shootings get a lot of publicity compared to some of the other incidents that we don't hear about. Government property. So government property in this sense is government property defined. It's defined as public properties owned by local, state, and federal or tribal governmental entities. So this does not include military installations or DoD rented buildings. So there was 19 incidents, 73 total casualties, 17 male shooters and 1 female. 8 shooters were killed by law enforcement. And I'll let you all look at the different ages. I couldn't believe that this one went all the way up into the 80s, but this is another incident where we have 1 unknown. Military property is basically public property that is owned by the U.S. government, but it's primarily used or reserved for DoD and military use. So there's been 7 incidents, 92 total casualties. They're all male shooters. 4 shooters were killed by the police at the scene, and their ages were their 20s, 30s, and 60s. So there's not a lot of range in this one. Healthcare facilities, it encompasses all types of healthcare facilities, both public and private, doctor's offices, hospitals, emergency care clinics, health departments, all of that fall underneath of this umbrella. So there have been 12 incidents, 55 total casualties. They're all male. 1 shooter, this was one of the few times that this happened. 1 shooter was apprehended by the police at another location. And so the ages range 20s, 30s, 40s, and 50s. It did not give me a breakdown on race or shooters' ties to the location. So I kind of wish it would have went a little more in detail on that, but it was pretty interesting otherwise. Houses of worship. This includes both like normal churches and then, your locations like the rented, you'll see the churches pop up in the malls. So any type of location that is deemed a religious, you go there to worship. So there's been 11 incidents, 131 total casualties. They have been all male, and 1 unknown shooter in this. So the ages range from the teens all the way up to the 70s, which I was really shocked to see how many of our shooters were 50 and over. Okay, so open spaces is basically anything like the Las Vegas shootings considered an open space. So anything that's not encompassed by a building. So there's been 37 incidents, 758 total casualties, 37 male shooters and 1 unknown. 19 shooters committed suicide before law enforcement arrived on scene. Their ages go from teens all the way up to the 60s. Primarily, we're seeing more in their 30s and their 40s and their 80s in this group. Okay, residences is any type of dwelling that's a house, typically. So there's been 12 incidences, 77 total casualties, 12 male shooters, and the 2 unknown. Two are still at large, so I'm gonna assume that's the two that they don't know if they're male or female. And their ages are teens, 20s, 40s, 50s, and the two unknowns. And then the reference for this was the active shooter incident in the United States, 2000 to 2018, the Federal Bureau of Investigation, U.S. Department of Justice, Washington, D.C. Do I have any questions? I know I kind of went fast, but looking, I mean, it's data sheets, and past giving you all what I put in the slides, it would have been a lot of repeat data.
Any questions for Heather? That was really interesting overall for what's going on. I'm kind of surprised there actually weren't more casualties total in 8 years than we saw, but it's really good information and things we don't think about a lot.
Yeah, I was really surprised at the female shooters tend to be, I couldn't believe that they got their own white page, but I mean, the number was so low that I guess it's a phenomenon for when it happens, but they typically were a little more aggressive than the males. But there was a lot of locations that were male only shooters. I would have liked to see a little bit more of a breakdown on the demographics of the shooters to know how they're tied to each scene. But it was really interesting digging into this, and I'm almost certain that this document is open to the public if you want to go and look at it.
Okay, thank you.
Thank you.
Okay, Doreen, what's next? Okay, I'm going to give you all just a quick update on COVID. I'm sure everybody's following the news and what's going on, and we're like several other states, but not nearly quite in the difficulty or the high numbers that they are. But our number of positive cases, our number of total cases are going up. They're about 2,500 right now. The health department is seeing about 50 positives per day. And we've had another death yesterday. So we're up to 42 deaths. And I sit in on the health department briefing every morning, and it really is community wide. I mean, there's certainly little pockets here and there that come up. Our long-term care facilities are seeming to level off a little bit, but there's been a lot of cases in almost every long-term care facility we have in Lexington. It's been in all types of businesses. We're seeing some in child care facilities, both children and the staff, adults. And obviously we're seeing some from folks that travel and come back from some of the places, particularly Florida and South Carolina, but that come back from some of the places that the governor now has a recommendation for. You know, so we truly are at a turning point in Lexington and in Kentucky that if we are more compliant in wearing masks and in social distancing, then we really have an opportunity again to try to flatten this, or there's lots of thoughts, both locally and statewide, that we will continue to go up and could end up somewhere with some of the higher states numbers and issues. A couple things that's been emphasized by the health department is that they're seeing people unfortunately work when they know that they're sick. And I think part of that's because folks are concerned about, you know, losing their job or not getting paid or whatever. But what they end up doing is infecting other employees and other peers in their workplace. So it's really hurting the business. It's spreading the disease. So somehow we have to get the message out that, you know, working while you're ill is not a good thing to do, and it's not going to help us lower our numbers and put this thing to rest. So if all of you individually can help spread that word, that's wonderful, because those are two things that we all can do and try to help. The other thing is that there's a little bit of data starting to show up, not only in this country, but in other countries, that this disease may leave some long-term healthcare effects that now people are seeing that they're starting to have to deal with, like lung disease and some other things. So, you know, to help the youth, those from 18 to 34, understand the seriousness of this disease, is that it may not just be while you're sick with COVID, but what it does to your body while you're sick may easily cause you some long-term effects. So I think those are two messages that the healthcare community is asking us to help put out there. So I think that's real important. Like I said, it is everywhere in the community. There's not just one place. Numbers are going up. Our hospitals are fairly stable, but they also, if you look at the numbers, you know, our numbers go up, so that they have less and less capability as we go through this. So that's another thing we have to look at. So just wanted to give everybody the latest. I mean, testing is another demand and common thing right now that we're wrestling with. We're doing about 1,000 to 1,100 folks every week at the BCTC test site. We're doing another 1,200 with our mobile testing sites, usually every weekend. I know the hospitals have increased their testing to all inpatients, on some of them, not just those that are going to have surgery. They're now starting to test any patient that has to be in the hospital. So we're seeing a lot more testing, and that's not what's causing our positivity rate to go up. It's still like for every 100, you get so many. If you tested 1,000, your positivity rate might not be, but still 1%. So, but ours is going up. It's somewhere between 5 and 7, depending on whose data and numbers you look at. So we are having more positives per the 100 tested. So again, this isn't going away. It's going to be here through the winter, if not into spring, depending on when there might be a viable vaccine available. So any questions for me, or I think there might be some health folks on COVID. Okay, hearing none, I will go on. I just wanted to talk a little bit again about the CSEP exercise. I think Tabin mentioned that previously that we had asked to be approved to not do a full-scale exercise and just do functional. We and the hospitals have been approved for that. As I stated, we will do a functional exercise. So especially for human services, police, fire, and the health department, we will not only need the person that serves in the EOC proper, but we will need representatives from your agencies that normally play in the field to be in the reception center room that we're going to set up as the field location, in the shelter room that we will set up as if the shelter was open, and in the other side scenario room. So some of you may need 2 or 3 folks here from your agency for that day. If you have any questions about that, just let me know. Tabin, am I forgetting anything? Is there anything else you need to say about the exercise?
Nope, nothing else that I can think of. I mean, other than if you want to participate and you're not sure how or what you can do, just email me and let me know. And we're always willing to accept more people in who want to play. So I think that wrapped it up pretty good.
Okay, any questions on the CSEP exercise? Okay, I wanted to give you an update on the destruction process at the Army Depot. We got our last briefing July 8th from them. Go ahead, Doreen. Go ahead, Doreen.
Do you not see the bluegrass plant update?
Yeah, but I need to go to the next slide. I'm not.
Oh, I'm sorry. Okay.
No problem. Okay, just so that you know, they do have a lot of folks, a lot of safety measures in place for COVID as well as everyone else. I think they had said they only have like 40% of the workforce that they rotate there any one particular day. They've had one worker test positive. So that is an important thing that they do. They take temperatures, and they, do the questionnaire that a lot of businesses do about your symptoms and those types of things every day. So they are making adjustments and changes for that. Go ahead, Doreen. This is a slide, and it's a little misleading, but the original, the amount there, 12.93%, is of everything that's done. If you look over at the second part of that, 1,500 tons of agent, basically they're about halfway complete with the mustard agents. That's about halfway finished, or about 43%, so it's almost halfway. They are still retooling the systems in the plant to start VX. They are finished destroying all of the GB that was in the warheads, but they're not finished with destroying the rockets and projectiles that the GB were in. So each agent is in a different stage. Like I said, the mustard is about 43% complete. The GB is all destroyed as far as the GB agent itself, but the projectiles and missiles are still in process of being destroyed. And the VX, they haven't started yet because they're still making changes to the plant. Now, one of the things they're still seeing issues with is the locking seals that we had talked about previously that were degrading rather quickly. They had thought they had solved that problem because they didn't degrade for a while, but that has become an issue again. So they're reworking that again. Go ahead, Doreen. As this says, they're still emitting mustard vapor within the EDT service magazine. They had a leaker, and it was actually what they do is they take the mustard from the igloos, move them to an overpack that is actually just outside of the plant. They had a leaker in there, so they stopped moving mustard agent into the plant for a while they overpacked and took care of the mustard that was leaking. Go ahead, Doreen. This is a little bit of the foundation and the wall for the new additional static detonation chamber that they're building. And part of that will be in place to both destroy the VX and to help at the end of this to destroy the projectiles and the missiles from both GB and VX. Go ahead. Again, this is just inside the plant. That's part of the process of decontaminating everything that was used for GB, making sure there is nothing left so that they're getting ready for the VX, because they can't have the two agents mixed. So this is just part of what they're doing to retool and get the plant ready for that destruction campaign. Go ahead. And these are just other things that are happening. A new rocket line is being demilled and beginning to be built this month. So it's, again, just part of the process with this situation. And Jim Powell asked a question, what are they going to do with the old igloos? You know, I don't know, Jim. There's another group of Army folks that are working on a plan to what to do with that whole area of the base. I don't know how many of you have ever been out there, but the chemical activity area is a fairly significant acreage size part of the Army depot. And there's a group that's working on what they plan to do with all of that property. They're going to move another part of the Army in there, if they're going to increase their regular munitions side. So I don't know that there's an answer to that yet, but they are working on what they're going to do with that. Go ahead, Doreen. They do have to get permits from the state in order to do some of this, and they have submitted those requests for modification to their permits to the Kentucky Department of Environmental Protection. So the comment period runs now through August 24th, and there's a a link there if you want to go to the permitting page for that. Go ahead. Okay, one other thing I just want to say again that the Army continues to make clear to all of us in the CSEP world is that there is definitely a difference in the timeline between treaty compliance and CSEP ending. They will have all of the chemical agent itself destroyed by December of 2023. Used to be that meant CSEP was going away in December 2023. Apparently there's a subtle difference in treaty compliance for all of the liquid agent to be destroyed and the containers that held them being destroyed. So by treaty, having the liquid agent destroyed by December of 2023, they meet the treaty obligation. But yet they will still have several thousands of containers that held agent that will need to be gone through the destruction process. So with that, they are fairly certain that CSEP and the mission of CSEP being protective of the community, maybe in a lesser form, but still will be here probably into and maybe through all of 2024. They haven't set a firm date, but the last time we were briefed, they did indicate that the Army is working on a new timeline for that second piece of what's going on. So at one time, we all thought that everything would be gone and the program basically would be ending in 2023. That is not correct any longer. The treaty will be met by December of 2023. The agent, the liquid agent, will be gone, but CSEP and the rest of the program about destroying the material that held the agent will last probably through 2024. So any questions on the destruction process or timeline out at the Army Depot in Richmond? Gosh, you're an awful quiet group today. No questions. It's kind of scary. Okay, Doreen, pull up the training. As you know, a lot of training has been canceled. A lot of it, they are trying to turn into virtual training. Right now, the classes that are listed here, and we will make this part of the minutes, are still on. I doubt that the August training will hold. I expect that to be canceled. but I know that EMI and many of the TEACs and many of the common training groups are really working to try to put most of their stuff into a virtual format. When that becomes available, we'll certainly let everybody know. It's probably going to be a little bit difficult to put ICS 300 and 400 into a virtual format because of the teaming and other things, but I'm sure if there's a way to do it, that those folks will figure it out. So as soon as we know of things that are virtual, we will certainly send that out to you all, email, as well as making it part of the monthly meeting. So like I said, we'll make sure this sheet's part of the minutes, but I really don't think that the August classes listed on here will hold up. We're all still too much in an uprise the numbers going in the wrong direction. So the other thing I just want to ask is if there are topics that you're interested in or other things you would like us to bring forward, that, you know, we can certainly do that. So please, any suggestions you have for training topics, get to myself or to Shelley, and we'll work on that. And then the one last thing I have that really isn't on the agenda, and I don't know if Doreen can bring it up, but I do want to show you a new board in WebEOC. It's called the Hospital Dashboard, and you can only like the command staff, the ESF8, and those people that have a view now of the hospital board will be able to see this. But it's a really great board in that it's strictly for COVID. It's a dashboard that can give you total cases, the number of vents in use, the number of patients period in the facility, and it can be done by either the statewide or by region or by county. So it's a really good thing for me to look at every day to see current cases that we have here in Fayette County, those in ICU, how many vents we have left, how many beds we have left. So it's a really nice dashboard to be able to use it. And there we go. Thank you, Doreen. Can you possibly filter that to Fayette County up there at the county? And you can see we have 6 new cases today that have come into and they're just really tracking this from the acute care hospitals. We occasionally have some in the hospital at Cardinal Hill or Eastern State, but their numbers are pretty small. And if you can you scroll down just a little bit, Doreen? You can see today we have 1,400 cases, the total census in the hospital, and if you go and look at total beds, you could subtract. Here tells you that we have 137 over there on the right-hand side, Doreen, under hospital data. If you could circle that, the 137 total COVID patients in our hospitals. It's a little misleading because that is probable and confirmed. So people that they think have it, but that haven't got the test results back. So I think we actually have maybe 80 that are confirmed in the hospital. So again, it gives you real good information, and it lets you calculate surge beds and other types of data that's real helpful. So this is a new board that the state put together to make the COVID information a little quicker. And then for every other day usage, you just go back to the regular hospital board. So I just wanted to share that with you and let you know that that was out there and available to kind of look at. Okay, does anybody have anything else new in their group or organization that they would like to share? Police, fire, Trina for Human Services. Oh, one other thing I do want to mention, and Doreen can send you this if you're interested. We are having a training tomorrow. It's virtual, and it's we're going to have presentations from the Autism Society, KCCRB, Deaf and Hard of Hearing Council at the state, and several folks who will give you some tips and some things to look at when you might be working with folks who have these issues. So it's kind of really good to learn a little bit about working with folks that may have mental or physical disabilities, and maybe give you some tips on how it's best to approach them or other things. So if you're interested in that training, please let me or Doreen know, and she can send you the Zoom invite for that. It's like from 9 to 4, and it's all virtual. It's different speakers, and so you could come in and out of it as you had time. But I think it's going to be a really good training, and I think it'll be useful and helpful to folks. So
I'm definitely looking forward to it.
good. I really do think it's going to be good. And Shelley did a fantastic job putting it all together, and coordinating it all. So we have her to thank for all of that hard work.
Thanks, Shelley. So cool.
Brandon, go ahead, Tabin.
Sorry, I was just gonna say right quick about the training. I really hope you all can be on there, but also for Human Services, Red Cross, Health Department, if there were any findings or observations in last year's exercise regarding this issue, which there were for some folks, this is one of the ways in which we are helping to fix that is with additional training. So this is really important to attend, especially, you know, to help fix up those observations from previous exercises. But again, yeah, just as Pat said, if you guys sign on that training, ask Doreen, or I can even share the link with you as well. But thank you.
Eugene, you got something?
Yeah, Pat, I just want to give you an update on Sally. Sally Higgins, she's doing well. She is in the process now making the last trip of bringing her sister down from Connecticut, because she is moving down here to help take care of Sally. Said that'll probably be the last trip until they go back up in the holidays to visit the grandsons. She said it's interesting traveling between the states of how the COVID response is being handled. But she says she's keeping her mask on, if not for everybody else, at least for her. But she is doing well. It should be a matter of time for her to get back up and going. So just everybody keep thinking about her and keep her and the family in the prayers after what happened to James.
Great. Thank you. And I love your suit there, Eugene, your picture. That's great.
Yeah, I was given that a picture from somebody in the Red Cross a while back, and I decided to use that as my cover because I don't like to be on camera too much.
Well, I like it. Brandon, anything for schools? And you all are certainly welcome tomorrow to attend that training. It may be useful or helpful. But anything for you all, I appreciate, and I want to say thank you to Brandon and the schools, if Amy's on as well, for letting us do a mobile testing site out there at Cardinal Valley Elementary tomorrow and Friday. So thank you much.
Yeah, no problem. The school board's meeting tomorrow, I guess tomorrow afternoon, just to decide whether they're coming back or they're going to be doing the virtual learning. So we're all kind of waiting for that and see which way we're going to be headed come this fall when school starts back.
Okay. Chris, anything from police with you?
No, ma'am, we're good. I appreciate it.
Okay. Trevor with fire?
No, nothing really. We're still just kind of isolating. We try to keep each station kind of separate from the rest, so to kind of limit our interactions between the stations. But so we're still doing that. We just have a 4 or 5 on quarantine and with 1 case right now.
Okay. Thank you. Anybody else with comments? All right. Appreciate it very much, folks, for your time. And we will see you next month. Thanks again.